So with Vivlio, do you guys plan on working with other like tech companies? Because having information super, it's a powerful tool, kind of like how data companies now or social media companies use our data to do targeted ads or influence people in a way to get new products. Is that something that you guys perhaps will work in a space with, or perhaps go
Yeah,
to? Because I know it's kind of difficult because you're kind of getting into this area of like taking advantage of a bad situation where you're like, if your back is in pain and like this person knows that they're in pain, they're going to send them ads for like a
oh,
back
yeah,
brace or
yeah.
something. So is that something that you guys were thinking about, or is that a possibility?
Yeah, we're gonna promote a new drug ad that's gonna just pop up in your feed. How did they know that? I love that thing.
Yeah,
No,
right.
that is not our goal. That actually is not even on our roadmap at all.
Good.
We
Yeah.
What we are attempting to do, the problem we're solving is really breaking down those silos and connecting these other endpoints. So working with EMRs like Epic, Cerner, Meditech, to be able to connect to those endpoints and share data where they don't exist. So an example of that would be if you go to a hospital that has a specific EMR and you're being referred outside of their network to another one, another hospital that has a different EMR. If those systems do not connect, quite frankly, probably never really had the intentions to connect and exchange data. So the 21st Century Cures Act breaks down that barrier. And so we're going to sit in between them to help communicate and pass data back and forth. Um, because of a lot of the privacy and things of that nature around HIPAA, PHI, how you're using data, healthcare companies are really not allowed to abuse patient data in that way. So not only is not in our roadmap, we just have zero interest in doing that. It's really about um, getting clinicians the right information at the right time to treat the patient, and then from there, making our patients more informed about their care.
Yeah, and for people that don't know, each medical or each hospital or any facility that you go to that provides care has an EMR, and all EMR stands for is an electronic medical record, and not every place uses the same one. So let's just say if you're in California, Kaiser is a really big hospital here, and so they use Epic.
Yep.
And so if you're attached to, when you go to a doctor and they write up a report, it's now in Epic and it will go to all the Epics. So if you go to a Kaiser in Los Angeles versus San Jose or Sacramento, it's all going to be there. But let's just say you go to out of state and you go to Florida and you go to, well, Florida has Kaiser. If you go to like Nebraska or anywhere that doesn't have a Kaiser and you use a out of network thing from Kaiser, they may not see anything from Epic. They're going to see absolutely nothing, and you're going to have to be responsible for getting all the information.
Exactly right.
And so that's what Vivleo Health is kind of bridging the gap between that. So it's all in one place, and you don't have to go running around grabbing information, grabbing X-rays, grabbing blood work, and so forth, because it can be a hassle and a half to try and grab everything.
100%. Yeah, 100%. You got it. It's a hassle, and we see it every day. When we started the company in September, we went on our listening tour and spoke to, I don't know, 40, 50 clinicians, their staff, patients, and you started to see these themes emerge, which really affirmed that we were attempting to solve the right problem, but it also allowed us to narrow down on specific problems and use cases, and how we will build out and roll out our product.
Yeah, and so it makes so much sense, right? You guys have like it almost seems like your solution is the smartest thing to do, but why is there some resistance, or why is it not being adopted as quickly as you'd like?
Yeah, so healthcare is slow to change. I think in the United States, it's not that these systems don't have the ability to, right? And within healthcare, um, we are one of the last industries to adapt newer technology. So, but there are other companies that are attempting to do this, and they're forging their way through incorporating things like machine learning and AI. Like GE Healthcare has an incredible initiative around that, and they're doing some really powerful things there around how they're using data to make better informed decisions on images, and treatment, and diagnosis around certain disease types. So that's super cool. But we're a long way away because these systems are so disconnected. So using a hospital as an example, let's say they were on an old EMR and they are upgrading to, say, Epic, those two EMRs will exist in that healthcare system for a long period of time. So Addison as a patient may sit in Epic because I just presented with a new case, but all my history is in this old one. Why they can't get rid of that? Oh, but these two systems don't talk. So just imagine that at all the healthcare systems and the small physician offices. So it's going to take a while to connect all of those. And in some cases, that data still exists on paper. So, and in more cases than not, when you are exchanging medical records, that happens via fax. So there is a fax machine that is either being scanned in, or maybe you're using a very high-end one that's super powerful, but needless to say, it's somehow still being exchanged on paper. So we know that will be around for a while. We're trying to take the first step to help move that forward.